Fantastic to have so many people here tonight. Welcome. Welcome to tonight's evening symposium for the ANZUP Annual Scientific Meeting. I'm Ian Davis, I'm the Chair of ANZUP, and it's fantastic to welcome you here. I'd like to acknowledge the traditional custodians of the lands on which we're meeting, the Kombumerri people, and pay my respects to elders past, present and emerging, and extend those respects to any First Nations people here today. I'm not going to talk for very long. I just want to make one comment, and that is it is the year 2024. In 5 years from now, the Terminator will come back in time. Terminator came from the year 2029. So I just want to put that out there because our theme tonight is going to be about artificial intelligence. But before we do that, these events cannot happen without support and sponsorship. And I'd like to invite Michael Eisbacher to say a few words. Thanks, Michael.
Good evening, everyone. Yeah, my name is Michael Eisbacher. I'm the Medical Affairs Director, actually, for Johnson & Johnson. We're now known as Johnson & Johnson Innovative Medicine in Australia. I'm responsible for our oncology portfolio. And I'd really love to say a big thank you to all of you for coming along tonight for this very interesting topic. At Johnson & Johnson globally, our mission is to eliminate cancer. And our ambition is to actually do that by creating curative and synergistic treatment regimens. And our entire clinical development program, including in GU oncology, is really all sort of shaped around that. And I know you're probably all sitting there thinking, geez, what the hell does this got to do with generative AI and artificial intelligence? Well, I think that in order to sort of realise that vision, there's going to be a really important role, or generative AI or artificial intelligence will actually play a really important role to make that happen. At Johnson & Johnson, we're investing really heavily in this space, both in our medtech sector and also in our innovative medicines or pharmaceutical sector where I operate. So just to give you a bit of a flavour of some of the things that we're interested in as an organisation and where we see this space heading. With the immense power that we have with generative AI and technologies, it really enables us to analyse huge data sets and start to make predictions around how we can generate insights around to inform drug discovery, to come up with new targets for patients. We're using and starting to explore how to utilise generative AI around clinical trial site selection to start to predict where clinical trials may be recruited more quickly at particular sites or particular patients. In the future, we think that perhaps you might be able to use Gen AI to predict ahead of time the risk of a particular patient progressing based upon such large data sets. And not only that, what kind of therapies might actually be best to work for those particular patients in the future as well. And there's a whole range of other areas where artificial intelligence will apply in our business. In our supply chain, for example, we're using Gen AI to start to predict variations in customer demand, to think about how we can actually get products to patients and to suppliers as well. So, the potential for this technology is really, really, truly astounding. I think the one last thing that I would say, though, is that our view is that the most sophisticated thing, however, today is still the human brain. And, generative AI is really there to help assist and improve the speed of decision-making and the quality of decision-making as well. So I'm really looking forward to tonight's symposium and discussion, and I hope you really enjoy the evening. Thanks very much, Ian. Thank you.